Right.
lymph vessels.
Right. So one of the functions of the lymphatic system is to take excess fluid that escaped the cardiovascular system and bring it back to the right side of the heart. So did I explain to you the difference between lymph vessels and arteries and veins? Did I explain that difference? Okay, good. So lymph vessels are more similar to veins, right? One-way valves, no pressure. That's how you get that stuff back to your heart. All right, so watch and write this down. Very important, very important. All lymph fluid has to be filtered by a lymph node before it gets dumped into the right side of the heart. So lymph nodes work like the security at an airport, right? It don't make no never mind where you're going or where you're coming from. Before you get on a plane, you gotta go through security. So the security of your body is the lymph nodes. And the lymph nodes are located in two regions of the body. Number one, lymph nodes are located at openings of the body. Right? Where does bad stuff come from? The openings in your body. So your GI tract is one big hole in your body. So 70% of your lymph nodes are located in your GI tract. That's why GI cancers tend to be devastating, because one of the ways that cancer spreads is through the lymphatic system. The second place is surrounding the central circulation. And I don't know if you know this, but there's an 11th commandment. And that 11th commandment states that thou shalt not get thou shalt not get bacteria into the central circulation. If you get bacteria into the central circulation, you have sepsis. Do you want sepsis?
No.
Sepsis is bad for you. And there's a lipoprotein on the surface of bacteria. Listen up, I'm just talking here. Watch. So when you get bacteria into the central circulation, that lipoprotein can fall off the bacteria and it can affect people mentally. That's why one of the signs of a urinary tract infection and potential sepsis in the elderly is people get goofy. You know who will explain that to you?
Why wouldn't that affect younger people?
They don't get sepsis.
Only the very young, the very old, or the very sick that don't have immune systems, and only 11% can survive if they have.
That's right.
See, I watched the videos.
Oh, you did?
That's where I learned that from. I wasn't that smart.
Oh, because I was thinking to myself, boy, that sounds good.
You said that.
I'm going to give myself a high five and pop my blister. Emily, I hate me too. Tell me you got that. All right. So, watch. And I'll get to it in a minute. If you have a sore throat, one of the things the doctor is going to do is say, and they're going to look, because they're looking at your tonsils. Tonsils are lymphatic tissue. Say, yeah. Then they do one of these numbers, right? Because if lymph nodes are producing lymphocytes, they become swollen and tender. So if you have lymphadenopathy, swollen, tender lymph nodes, the infection is pretty bad. That's how a doctor will determine whether or not antibiotics need to be given. And I'll explain more about that in a minute. So, again, do you have lymph nodes everywhere in your body?
Yes.
Do you have lymph nodes in your toes? No. So, all lymph fluid in your legs is filtered by your inguinal lymph nodes. So if you have an infection in your leg, would it be appropriate for your doctor to palpate your inguinal lymph nodes? Yeah. If you have a sore throat, is it appropriate to palpate your inguinal lymph nodes? No, the guy's a pervert. Tell me you got that, right? If you got bad infection in your arm, where's the lymph nodes? Axillary, right? me you got that. You're following this. Okay. All right, here we go. And did I explain to you why you shouldn't draw blood on a woman who's had a mastectomy? Do you know why?
They don't have any lymph inside. They don't have any lymph nodes on that side.
Yeah. That's it.
What if she's had a double then? Where would you take it?
You take it on the leg. There's a fudge factor for that. Did you ever have any soldiers that had a mastectomy? Did you?
We had one with implants.
With what?
What?
Implant.
Oh. Like
To make his chest look bigger, or? Oh, okay.
Because he had half of his chest blown off, so when they
Oh,
removed it,
yeah.
he didn't have it, so they had to put him in an implant.
Yeah. Watch. One of the functions of the lymphatic system is to drain excess fluid back to the right side of the heart. Tell me you got that. When they do a radical mastectomy, they remove the breast, the underlying muscle, and then they remove the associated axillary lymph nodes. Are you following this? So what you have done now is you have severed the bridge between the lymphatic system and the right side of the heart in that arm. Tell me you got that. So if you put a blood pressure cuff on this woman's arm and you pump up the volume, you are going to force fluid out of the cardiovascular system and into the interstitial space. And does it have any way of getting back? No. So it will stay there permanent-like. That's why you don't do it. Why don't you draw blood in that arm? What's the best protection you have against infection?
Your
It-
skin.
Intact skin. So if you draw blood, you unintacted the skin, where does all lymph fluid get filtered before it gets dumped in the right side of the heart? But if you have those lymph nodes removed, that bacteria's got direct access to the central circulation, and through a simple blood draw, that woman can go septic. That's why you don't do it. The education continues. Roland, you liked that, didn't you?
I did.
See? Right? Because now you can go around and tell people.
Jen liked that too. When you were over.
What's that?
Jen liked that too.
You like that too? Right. You know what you can do? This is what I would do if I were you. I go to like Pick and Save or maybe Woodman's. Sit in front the door with a little table, and then as people walk by, tell them. Right. The education continues even at Woodman's. Right. Watch. Here's a woman who's had lymphedema. Right. That ain't going down. That's her arm. Tell me you got that.
There's no way they can drain that.
Nope. Because it'll just keep accumulating.
Isn't that why, like, women with breast cancer, they wear those sleeves?
You got that right. Because by putting on that sleeve, it increases the pressure in the interstitial space, so it prevents the fluid from the cardiovascular system from escaping. So interstitial fluid pressure becomes greater than capillary fluid pressure.
So it's like TEDs for your arms.
Boom, TEDs for your arms. Now, the other thing I'd like to point out is, look at that Timex. Takes a licking and keeps on ticking. All right, here we go. All right, this is what I want you to really understand.
So what would they do with amputation?
What do you mean?
Like from the hip down?
What do they do with an amputee? What do you mean?
They have
Like
like
the
a
lymph nodes
sticker
in
for
that
blood
area.
pressure.
What do they do with the lymph nodes?
Would they take them out too?
I don't know. If they're damaged, they probably would have to. But if you ain't got no leg, then you ain't got no fluid to drain.
Yeah, that's what I'm asking.
Yeah. Yeah, I mean, they probably would. And what they'll do is if there's no lymph fluid to drain because they're amputated, then they'll close off. They'll kind of like auto-cauterize themselves. Yeah, that ain't right. Okay, here we go. Watch. All blood cells are produced in what part of your body?
Oh, no.
The bone marrow. Say yes. And all blood cells start out as hematopoietic stem cells. That's a good word. You know, as you're walking down the hall today, just say hematopoietic. People start looking at you. Really weird.
Yeah, 'cause you're just saying words.
I know. Don't know what they
I mean,
mean.
are we all just saying words?
Kind of. Yeah, who cares?
Well, that's really.
We're all going to die anyways, right? In the long run, you're dead. Okay, so watch. This is what I want to point out. So they all come from the bone marrow. And then they differentiate into red blood cells. These are the formed elements of the blood. Are all red blood cells pretty much the same? Yes, because their function is the same. Then you have platelets. What are platelets for? Clotting, right? Are you only exposed to one thing? No, you're exposed to a bunch of things. So that's why white blood cells are different. Get it? Different. So when a CBC with a differential, if a doctor orders a CBC with a differential, you're going to get the red blood cell count and the white blood cell count, and then you're going to get a breakdown of the total white blood cells that make up the different types of white blood cells that make up that total. That's the differential. Say yes. Did you understand what I'm saying? Yeah or no? Okay. All right. This is what I want to talk about. I want to talk about the leukocytes. Are you with me? Now, when you talk about immunity, these are the guys that you talk about. These are the guys that deal with bad stuff, antigens and pathogens. First of all, you have innate immunity. What does innate mean?
Just there.
Yeah, you're born with it. You got me? Are you born with skin?
Yeah.
Good. Are you born with white blood cells? Yes, you are. Right? So this is how you remember the white blood cells and the order. Most numerous to least numerous. Are you ready? It's never let monkeys eat bananas. Mantogen. That was very serendipitous. Okay. So watch. The most numerous white blood cell neutrophil. Second most are the lymphocytes. Third, monocytes. Fourth, eosinophils. And fifth, basophils. Most numerous to least numerous. Tell me you got that. Guys? All right. So watch. This is what I'm going to explain to you. Watch. These guys are the patrol cops. They drive around in their squad, texting their girlfriend, really not paying attention to any criminal activity. Okay, watch. These guys float around in your blood and lymphatic system, and they look for bad guys. They'll kill anything. Do you understand? Who's with me? Guys? They'll kill anything. The lymphocytes are different. The lymphocytes have to be programmed. And how they're programmed is by you actually coming in contact with a specific antigen or pathogen. So when you're born, do you have any of these lymphocytes programmed yet? No. So that's why when little Egbert pops out, before he comes home, the family cleans the house, disinfects everything, right? Then they bring him home and the kid goes, right? Everything's fine. Then the mother and father got to go back to work. So they take him to booger-infested daycare, and that kid is sick all the time, right? Why? Because he doesn't have any lymphocytes programmed yet, so he's going to get sick. Say yes. That's how you program lymphocytes. So you think of these guys here, as the patrol cops. They'll kill anything. These guys, the lymphocytes, are like the terminators of the body. Right? Terminator was programmed to kill Sarah Connor. And if they would have just let him kill her, the movie would have been over in like 5 minutes. They didn't. Tell me you got that. All right? So, watch. You have different types of lymphocytes. You have T cells, B cells, and the greatest name for a cell ever, natural killer cells. Now, watch. Write this down. T cells, when they're programmed, how do they get programmed?
By exposure.
That's right. They get turned on and they become what are called cytotoxic T cells. And these cells kill directly. Right? They find a guy that they're programmed for. They attach to that antigen or pathogen and kill it directly. You got me? B cells are different. B cells, when they're programmed, they don't kill directly. B cells produce proteins called what?
Oh my
Not the mast cells, right?
What is it?
Mast cells.
Mm-mm. Gotta guess the letter. What'd you say?
Oh.
E. I can't see that.
At the very end, A.
L. T.
Antibodies.
Antibodies. Nobody knows how to play this game.
You got 2 letters and I can guess it.
Yeah, if you guys say, Timmy, I want to solve the puzzle.
Sorry.
B cells produce antibodies. Antibodies are proteins. Antibodies, once the B cell is programmed, it secretes antibodies, say yes, and those antibodies circulate around the blood and the lymph, and they attack a specific antigen and destroy it. Mark it for death. Say yeah. How many people are with me? You're following this. NK cells, they have to be programmed too. But NK cells are kind of like your, I don't know. Watch. They kill, destroy damaged or infected cells. Your own cells. You got me? Your own cells. So NK cells are involved in finding cells that have been infected with a virus and killing them. Finding a cell that is doing jacked up stuff and kill it. Finding cancer cells and killing them. The problem is that NK cells can't keep up with how fast the cancer divides. So real smart people with tape and pocket protectors have altered the DNA of these NK cells to identify cancer cells earlier so that they can destroy them. And if you destroy all the cancer cells, you don't have cancer. And because what? This is the good part. Because they're your own cells, there's no side effects. So the cure for cancer will be gene therapy. And how they will get that gene into those NK cells is through a vaccination. So the cure for cancer will be a vaccine. And it'll be FDA approved a week after I die of lymphoma.
Isn't gene therapy like really unsuccessful right now?
Yeah, but it will get successful. It will. Okay. Tell me you got that, guys.
So which would be like the flu vaccine? Because that would have to be.
That is T cells and B cells, and I'll explain that. No joke. Ready? Okay. What I'm going to do for you now is I'm going to explain to you the process of inflammation. You got me? Now watch. This is very important. Almost all diseases, every disease, starts out with inflammation. So if you can reduce inflammation, you can reduce the risk for disease. That's why you probably watched on the news how they talk about aspirin as this wonder drug. It cures colon, prevents colon cancer, all this stuff, because aspirin is an anti-inflammatory. People with rheumatoid arthritis, so they've been on heavy-duty anti-inflammatories since very early. Their incidence of cancer is 1/8 that of the general population. How do you explain that? Well, one of the ways that you explain it is it reduces inflammation. So all diseases are a process of inflammation. And again, if our inflammatory response was perfect, ideal, then everything would be fine. But it's not. It's a generalized response, and that's why we died. That's sad. Okay, ready? I'm going to explain to you the process of inflammation. Say yeah. Before I do that, I got to give you a couple of things. Write these down. You need to know these. Number one, in all of your tissues, you have these cells called mast cells. And mast cells contain a chemical called histamine. And histamines do two things when they're released from mast cells. Two things. They cause massive arterial vasodilation and increased capillary leakiness. Are you with me? Okay, watch. You're going to get this. Well, write this. I gave you the final, right? Write this next question, another question in the final. Right? I told all my other classes I was going to add this. Where are white blood cells found? In the blood. That's the answer. Boy, you hope you get that one, huh?
Heck yeah.
Where are white blood cells found?
In the blood.
In the blood. What's the most numerous white blood cell? That's right. Neutrophils, a white blood cell. Most numerous, and they are the first on the scene. They're like the patrol cop. You got me? Now watch. And I'll explain this and I'll show you. When neutrophils come in contact, when they contact an antigen or pathogen, we'll just say a pathogen, and I'll show you in this video. That neutrophil, when it comes in contact with a pathogen, that neutrophil releases chemicals. Are you with me? And one of the big chemicals that it releases is called prostaglandins. We learned about prostaglandins when we talked about fetal circulation, right? Prostaglandins, when they're released from neutrophils, why did the neutrophil release the prostaglandins? Because they contacted a pathogen. You got me? Prostaglandins do several things. Number one, they increase inflammation. Number two, they stimulate Nociceptors. What's a nociceptor? Pain. Tell me you got that. And number 3, they can produce fever. So if you get a bacterial infection, what can you get? You can get a fever. Where are white blood cells?
And the blood.
Where does arterial blood always go?
Path of least resistance.
The path of least resistance. Say yes. Where are white blood cells?
In the blood.
Which is warmer? Arterial blood or venous blood?
Arterial blood.
Which is redder? Because it has more oxygen.
Is that why it gets swollen and red? There you go.
The education continues. What I'm about to explain to you, this information is so rock solid. When you leave, and Aaron, oh, I thought you were going to go. I don't blame you. I know it is.
I'm good.
Everybody leave 17 cents up front because this is worth more than the tuition you paid for this class. Ready?
Unforgiving cowboy good shot.
Yeah, I showed you that, right? Okay, here it is. Watch. This will be hard for you to believe. Well, hard for me to believe. Hang on, let me get this. Okay. All right. Surrounding all your tissues, you have mast cells. What do mast cells contain? Histamine. What's the best protection you have against infection? No, you said it before. Intact skin. So if somebody doesn't like you, and that's the thing that is very hard for me to believe. If they didn't like you and they took a broken broom handle and they stabbed it into you. Oh, look at that. You've unintacted the skin. Say yes. So with unintacted skin, watch it. These guys right here are mast cells. And what do mast cells contain? So when you damage tissue, you rupture mast cells. And what do mast cells contain? One more time. Histamine. So when you rupture the membrane of that mast cell, you're going to get a release of histamine. What do histamines do to those local arteries and arterioles? They dilate them. So when the little left ventricle contracts, where's a lot of that blood, arterial blood, going to go? The path of least resistance. And where are the white blood cells? Where are the white blood cells? In the blood. So as those arteries dilate, more white blood cells are going to come to the scene. What's the second function of histamine?
Create inflammation.
No.
Increase inflammation.
Stimulate.
What?
Histamines. They massive arterial vasodilation and
Capillary leakiness.
increased capillary leakiness. Is there fluid in the blood?
Yeah.
Yes. So watch. We're going to cut further in the interest of time. Okay? You're going to get these histamine released. Ready? Where is it? Right there. Whoops. You get the histamine released. What do the arteries do? They dilate and the capillaries become porous. Say yes. If the capillaries become porous, what's going to happen to the plasma of the blood, the watery part of blood? It's going to leak out into the interstitial space. Say yes. So that area will become red, warm, and swollen. Say yeah. Watch, and you know this. In arteries, the formed elements of the blood flow in the middle, and the watery part of blood flows on the edge. That increases laminar blood flow. With the histamine release and the fluid leaking out of the capillary into the interstitial space, what that does is allows the white blood cells, the neutrophils, to come closer to the edge of the capillary. Tell me you got that. So when those white blood cells touch the edge of the capillary, they can actually squeeze through these small cracks. White blood cells have the ability to move. It's called diapedesis. No one can argue with the fact that that would be a great name for a rock group. Diapedesis. Right? That's a good one. I'll give you 100 points of extra credit on the final if you name your child Diapedesis. Legally. Here we go. So watch. These little green Tic Tacs are bacteria. Say yeah. Guys? So watch. Histamines release, vasodilation, plasma's leaking out, so the white blood cells are getting closer to the edge, and then they will diapedese. Say yeah. They squeeze through those little capillaries. How do those white blood cells, those neutrophils, know that those are bacteria?
They don't.
Right, they really kind of don't. But you're right. But watch. How do the white blood cells know not to attack your cells?
Same DNA.
How do they know that? Okay, watch.
Oh wait, the mast cells move into the capillary and become neutrophils, right?
Don't listen to that.
On that? No, that.
Watch, I'm going to explain it. On the surface of your cells, all of them, you have a group of proteins called the major histocompatibility complex. You got me? That major histocompatibility complex, or that group of proteins on every cell of your body, identifies you as you. And the immune system is taught not to mess with any cell that has that group of proteins on it. Tell me you got that. What don't bacteria have? They don't have the major histocompatibility complex. As a result, anything that is foreign that doesn't have that major histocompatibility complex, the neutrophils are instructed to destroy. Say yes. Autoimmune diseases are a result of your immune system getting cross-wired. It didn't get the message that these cells of yours are good for you, and they attack them and destroy them. That's autoimmune. And watch, just listen to this. When someone needs a transplant, what they do is they look at that group of proteins and they try to find a person who has a similar group of proteins on their cells. That way, the immune system says, well, yeah, that's pretty close. So that must be me. I'm not going to jack with it. But regardless, unless it's an identical twin, those people, if they receive a new organ, they have to go on anti-rejection medication. They have to suppress the immune system. Otherwise, the immune system will attack that organ and reject it. That's rejection. Say yeah.
Can they eventually get
No,
off that?
no. They have to take it forever. I took care of a guy. He was like 36 years old. He was a karate instructor from Indiana. And he had amyloid cardiomyopathy. His heart was turning to stone. They found a transplant for him. I took care of him right after. The guy was like a perfect heart, right? He came out. He was doing good. He was in the hospital for about 10 days, and then he went back to, right? He felt so good, he stopped taking his medicine, came back in full rejection, and died. So the answer is, you have to take it for the rest of your life. Okay, now watch. When this neutrophil comes in contact with these bacteria and starts chomping away on them, it releases chemicals. What's one of the chemicals that it releases? No, mast cells release histamine. Prostaglandins. What do prostaglandins do? They increase inflammation. What else do they do? What else do they do? Right. They stimulate nociceptors, pain.
That's why it feels hot, it gets swollen, and it's red. Okay. Yeah. Makes sense.
It makes perfect sense. And it gets painful. Watch. If somebody stabs you, right? It hurts. And you want pain, because pain tells you something's wrong. Tell me you got that. So if you go, the old funny joke is, Doc, it hurts when I do that, don't do that. That's absolutely true. Pain tells you something's wrong. So if you do something that produces pain, don't do it. Now it hit me. Reading the textbook produces pain. That's why you don't do it. Oh, see? I had my awakening there too. Okay, so prostaglandins increase inflammation, right? They stimulate nociceptors, pain receptors in that area. That is why, listen up, because this is true, a general rule of thumb is the more pain you have, the more tissue damage. Say yes. Skin and areas of the skin have more pain receptors than others, right? Your hands, ouch. When I got that burn, I'm like, damn, it hurt, right? You burnt yourself, right? Probably flipping through those pages of the textbook, right? A little friction. Ouch. Get a little paper cut. So pain tells you that there's something wrong. Tell me you got that. Now watch. If you have a bad bacterial infection, write this down. I didn't tell you this. Prostaglandins also recruit more white blood cells to the area. So when they release prostaglandins, they're saying, hey, over here, dudes, we're getting our butts kicked. So when you got a big boil on your butt, that boil on your butt is a collection of bacteria and white blood cells. Say yes. Guys? Now watch. If the bacterial infection is bad enough, prostaglandins will get dumped into the blood. You got me? You better get this. There's no way you're not going to get this. There's absolutely no way. What part of your brain controls hunger, temperature, or thirst? You know what? Put that on the final too. Add that as a question. For real. I'm going to build your guys' confidence, and you're just going to come here and like, man, I'm going to be a legend. All right? What's in the blood because you got a bacterial infection? Prostaglandins. What's normal body temperature?
98.6.
Boom.
Holy shit.
You're not going to believe this, but you got prostaglandin receptors in your hypothalamus. And when prostaglandins bind to prostaglandin receptors, it turns up the thermostat in your hypothalamus. Now your new set point is 103. Now you got a fever. Is fever good for you or bad for you?
Both.
It's both,
Three hormones. Yeah.
right? So fever, watch it. The reason you want a fever, you better write this down. The reason you want a fever is that white blood cells work better at higher temperatures and bacteria replicate slower at higher temperatures. So the white blood cells work better, the bacteria don't grow as fast. Say yes. Okay. I went over this like the first day. If you get this, I'll give you some goggles. Ready? How do you know you're going to get a fever? How do you know you're going to get a fever?
You get thirsty.
Need in your bones.
How do you know? You know. What was the temperature before you got a fever?
98, so you feel hot.
Now you want to go to 103. Tell me so you got to get that core body temperature up. So what? Blood vessels to the extremities constrict. And you keep that arterial blood in the core. And because that arterial blood is warm, it's going to cause your core body temperature to go up. And you will start to shiver. Because contracting muscle produces what? Heat. And then you'll get goosebumps to trap that warm air. Tell me you got that. So you will start to get pale, you will start to shiver, and because you're trying to drive that body temperature to its new set point of 103. That's how you know you're going to get a fever. Say yes. How do you know you're getting better?
Stop shaking.
The bacteria is dead. The white blood cells become inactivated. And now, there's no more prostaglandins being released, and you go back to the new set point of 98.6. How do you do that? Sweat. All the blood vessels that used to be constricted in your skin and your extremities now dilate to dissipate that heat. That's how you know you're going to get better. Do you have any idea how good this information is? It's legendary. No one will explain it to you either. You get it here, or you get it in horticulture.
How do you know? You teach us better than third semester nursing students at Carthage.
Yeah, I know, they don't know any of this
Like
stuff.
pound per pound, we went at it with knowledge. We're good.
Right. You pay the price, you'll be straight. How many people followed this? Okay, watch. Watch. Do you want a prolonged fever?
No.
Do you want a fever?
Yeah.
How often do they tell you to give your kid ibuprofen and Tylenol? So the temperature goes up, stays up for a while, then you give them some ibuprofen and it comes back down. Why did they tell you to alternate ibuprofen and Tylenol?
So your body develops a resistance to one.
You have it's constant in the blood, so it goes up, and as soon as the Tylenol starts to wear off, the multi-stress will take effect lower.
That ain't bad.
They're not both inside.
Watch. Write this down. Your brain produces prostaglandins. Where do you feel pain? Where do you interpret pain?
Your brain.
In your brain. So when you have a fever or you have damaged tissue, your brain produces prostaglandins. What do prostaglandins cause in the brain? Pain and fever. Tylenol prevents the brain from manufacturing prostaglandins. So can Tylenol be used as a pain medicine? Yes. Can it be used as an anti-fever medicine? Yes. But inflammation occurs at the site of damage, and Tylenol doesn't work peripherally. It only works centrally. That's why Tylenol ain't an anti-inflammatory.
So that's why even if the 4 to 6 hours isn't up, you can give it, sometimes you can give it both at the same time.
Yes, because the mechanism of action is different. Tylenol centrally, ibuprofen peripherally. That's why ibuprofen is an anti-inflammatory, antipyretic, and analgesic pain medicine. Because it works peripherally. Where did you get the prostaglandins from? White blood cells. Say yeah. Ibuprofen, write this down too, prevents platelets from sticking together. So it's an anticoagulant, just like aspirin is. Who's following this? Why are you looking at me like that?
I'm trying to connect the dots before you do.
Oh. Okay, watch. When you have surgery, the first day out of surgery, they're giving you morphine. Do you know why? You just got cut open. It hurts. If you had general anesthesia, can you be swallowing pills? So they give it to you parenterally, right? IV. Tell me you got that. Now once you start farting, right, peeing, you can take it orally. Why did they give you Tylenol with codeine? Why don't they give you some codeine and then some ibuprofen?
Isn't codeine the anti-inflammatory?
Codeine's pain. That reduces pain. Why don't they give you ibuprofen?
Because ibuprofen is a blood thinner too, and if you were thinning the blood where you just had surgery, you would start bleeding.
That's why. You just got cut open. Your risk for bleeding is really great. Do you want to increase your risk for bleeding even more? That's why they give you Tylenol number 3. The education continues. Tell me you got that. That is, of course, beautiful. Okay. Let's say that you get through the nursing program, you work in an emergency room, and you're working triage. Someone calls you on the phone and says, hey, I twisted my ankle. What do I put on it?
Ice.
And they'll say, well, why ice? And you'll say, because that's what we do.
And you hang up the phone.
And just hang up right. Why do you put ice?
Because that's the vasoconstrictor. Because he's vasodilated. Not right, but kind of.
Yeah, he did really good, right, with the ibuprofen.
It's like a fever. You gotta do real good.
You gotta constrict the blood.
Watch. Write this down. Write this down. Are you watching? Are you watching? Who's watching? Healthy cells, jacked up cells. Jacked up cells, you got me? Watch. Inside a cell, you have preformed, synthesized prostaglandins. Tell me you got that. Where are the prostaglandins in healthy cells?
Inside.
Inside. If you twist your ankle and damage cells, those cell membranes rupture, and where do the prostaglandins go?
To the blood.
Close. They will attach themselves to the damaged cell membranes. What do prostaglandins do? They call on white blood cells. Where are white blood cells?
The blood.
In the blood. You got inflammation. Say yes, because you damaged tissue. White blood cells are attracted to the prostaglandins. And anything that's attached to those prostaglandins, that white blood cell is going to destroy. Say yes. So, what does heat do to the rate of diffusion of molecules? It increases it. So that area becomes red and warm, and the prostaglandins that were released by these damaged cells, due to increased rate of diffusion, they can start binding to healthy cells. Do white blood cells know that that's a healthy cell? No. It only knows that it's got prostaglandins bound to it, and any cell that's got that, I'm going to destroy. Do you want to destroy healthy surrounding tissue? No. So you apply cold when you damage your cells to reduce the rate of that spreading of the prostaglandins and destroying healthy tissue. That's why you do that. Where are the healing elements of the body? In the blood. That's why the first 24, 48, 72 hours, you put cold. Then, once you reduce that rate of prostaglandin diffusion, now you want to apply heat to that area because you want to get the healing elements of the blood there to rebuild those damaged and destroyed cells. Tell me you got that. If you got a big boil on your butt, where are the white blood cells?
In the blood.
What does heat do to arteries?
Dilate.
So by dilating the arteries, more white blood cells will go to that area. That's why, rule of thumb, damage your own cells, ice. Got an infection, heat. The education continues. That's top flight information right there.
Analysis.
What's that?
Analysis.
Yeah. Those things are the worst, man. You ever see a pineal cyst? You get it on the crack of your butt. You get squirt a little lidocaine in there, and then you take a scalpel and you open it up, and then you push, and that stuff comes out like a freaking volcano. And rotten tissue, the smell.
The worst is the treatment.
Yeah, no packing that thing.
Oh my god, don't.
Noodles.
That is the worst part.
I know, because it tunnels.
And they just dig it in there. It just keeps going.
I know.
Oh, God.
I'm like, damn.
Then they gonna look at me and be like, hey, put gauze over there. Hell no. You
Yeah.
got it down there. You've been touching it. You're good.
Yeah.
We walk into the medical space, and as soon as you smell it, pineal cyst.
It is the worst. Rotting flesh. Because watch. When you have a bacterial infection, the bacteria compete with the stuff that's in the blood with your cells. So as the bacteria start growing, they will win. And all of your other surrounding cells will begin to die. Now they're defenseless, necrotic, and that tissue dies. That's how a bacterial infection causes that crap. Yeah, I don't like that. I don't like that. GI bleed.
Never forget that one.
I had one woman, she had a tampon stuck up there.
It's more common than you think.
That's really common.
You get drunk and forget sometimes, man.
I'm thinking it had a smell, man. Because you went down there, I'm like, hey.
What does it smell good to begin with?
What does it smell like? Not good. You can imagine. You don't want to know. We'll leave that one alone. See?
Smells like rusted cars. Because of the iron and blood, don't get weird about it.
I wanted to have a chicken pot pie for lunch. I'm just playing. How many people followed that? That's the process of inflammation. That's how you get a fever. That's how ibuprofen and Tylenol work to reduce fever and pain. And remember, Tylenol works centrally, so it's not an anti-inflammatory. Okay? All right, here we go. Let me show you this. Every time I do this drawing, I think of a student 4 years ago. She goes, Tim, your drawings are terrible. And I said, can you do better? She goes, I think so. So I said, have at it. So she sat down, she drew like a foot with a shoe. Right? And I'm like, yeah, that's a lot better. I said, oh yeah? Well, why don't you teach us stuff then? All right then. Yeah, so you can draw it better? Nobody's perfect. Nobody comes to the game with everything, Robin. What do you want from me? Here we go. Watch. Gout in the immune system? Maybe, I don't know. Look, what do I know? I don't care. People say that's me when I say that. Is that me? No. Is it?
Say what?
I got mine, you gotta get yours. That's fact, right? Here we go. Watch. What's this? Wait, I ain't done yet.
A nail.
Right. Dude stepped on a nail. What's this?
A rod.
Lymphatic system.
Nice, it's a lymph vessel. Do you notice how I put the lymph vessel underneath the capillary?
Oh,
That's perspective, buddy.
now I do.
Yeah, now you like it. Okay, watch. What are the first cells of the immune system to arrive on the scene? Neutrophils. Tell me you got that. So watch. And who cares? We'll just call it a white blood cell. The white blood cell comes to the area due to the inflammatory process. Say, yeah, you got pain. I must have stepped on a nail or something, huh? There you go. The white blood cell is going to squeeze through there, and because you've unintacted the skin, you now have some bacteria in there. Let's see, what's a good color? Let's do this. We'll make B for bacteria. Tell me you got that. On the surface of the cell wall of the bacteria, you got these little proteins. Tell me you're with me. All right? And because this bacteria doesn't have the major histocompatibility complex, that white blood cell knows to begin to eat it and destroy it. Tell me you got that. So the white blood cell, through the process of phagocytosis, right? What's that? Which requires ATP, that's very good. It's going to eat that bacteria. Tell me you got that. Now watch. The cells of the immune system do not respond. They don't look at, oh, hey, that's a bacteria. They look at the receptors embedded in that bacterial wall or viral coat. Tell me you got that. So what's going to happen is after that white blood cell eats it, then the white blood cell does what maybe you did with quiz number 1. No. They hang those little proteins of the bacteria on their cell membrane. So maybe you put your quiz 1 on your refrigerator. Did anyone do that? All right, fine. Watch. The white blood cell, this neutrophil, ate the bacteria. What did it do with the receptors of the bacteria?
Wearing it like a trophy.
Right. And it will find the nearest lymph vessel, and it will be transported to the nearest lymph node. And if it's in your foot, where are they?
Inguinal.
Right. That's a good word, too. Inguinal. Are you ready? Write this down. In the lymph nodes, you have T cells and B cells. I want to talk to you about B cells. B cells have receptors embedded in their cell membrane. Are you following? These receptors are actually proteins called antibodies. So these antibodies are actually receptors. Write this down. I'm not even playing. You have millions and millions of different types of B cells. You got me? Now watch. Now, for the sake of time, I'm not going to draw millions and millions of different B cells. I'm going to draw two. Have you ever been to a party, a big party, where you only knew one person? Never? Okay, well I have. So I'm going to use me as an example. So what I do is I get a little toasted before that, you know. Then you go to the party, and your first thing that you do is you look for that one person you know. Right? You go through that little, swarm of people trying to find that one person you know. That's what B cells do. They swarm through your lymph and blood, and they look for that one antigen or pathogen they know. Tell me you got that. Any other antigen or pathogen they don't care about. They're just looking for the one that they know. You got me? So in this case, what happens, now we're in a lymph node right here. You got me? And this is what's referred to as a naive B cell. Very easily taken advantage of. Right? And in many cases, you don't even have to take them on a date. Tell me you followed that. Did I tell you my girl's birthday's coming up? Did I tell you that? So she wants to go to a really fancy restaurant. Did I tell you this?
Yeah, you said.
Yeah. And if there's like 3 or 4 cars in that drive-through, we ain't going. Okay. Here we go. All right, watch. What did you have? You had the white blood cell. Ready? The white blood cell eat the bacteria and bring it to the lymph node. So we're in the lymph node, right? If you've never been exposed to this, do you have a B cell that is sensitized to it?
No.
So this naive B cell who's never been come in contact with the thing that they're programmed for now comes in contact with it. Are you following me? And when that B cell, naive B cell, comes in contact with this white blood cell that has embedded in it cell membrane the receptors of that particular bacteria. Hope this works. Whoops. Oh, what happened there?
You drew it all together.
Ah! Okay, wait. Here, I'll just add another receptor. See how easy that is? Boom. That naive B cell comes in contact, and it gets turned on. So when a B cell comes in contact with the antigen or pathogen that it is programmed to destroy, it gets turned on. And I want this, and that B cell immediately divides into memory B cells Say yes. Guys, what do memory B cells do? Spitballing here.
Memorize.
They memorize what you came in contact with. And then they divide into plasma B cells. And the plasma B cells then begin to produce specific antibodies to that particular bacteria. Tell me you got that. Now watch, this is the important thing. This is the important piece. On your first exposure to this particular bacteria, the antibody response is very, very, very small. And it takes a while. It can take days, weeks, or even months for this process to occur. In the meantime, you get sick. Say yes. But you got better, you started reading the textbook, right? That can always help. So the next time you are exposed to that bacteria, what do you have lying in wait? Memory B cells. And those memory B cells, then, when they come in contact with it, they divide not into one plasma cell, but hundreds of thousands of plasma cells. And each one of those 100,000 plasma cells secrete thousands and thousands of antibodies specific for it. And watch, this is the important thing. It doesn't take days, weeks, or months. It takes sometimes hours. So you will create those antibodies in a matter of hours, and it will attack it and destroy it before it can affect your body. Say yeah. So how you program B cells is by being exposed to it. Tell me you got that. All right, now watch. Watch. Let me do this and I'll give you a break. All right, watch. What's this?
Antibodies. B cells, antibodies.
Yeah. Okay. Watch. Does your immune system know the difference between you going to Walgreens and getting the flu shot or someone hacking a loogie on you and you getting the flu? It doesn't know the difference. The response is the same. So all vaccines work like this. They give you the virus or bacteria that causes the disease with the hopes that the virus is inactive and the bacteria is dead. Now, smallpox vaccine, that's a live virus, so you can actually get the smallpox from the smallpox vaccine. So if you're old enough, like I am, on this shoulder right here, I got a little round thing right there where I got the smallpox vaccine when I was in like 2nd grade. They had like a little gun, remember that? Bam. Boy, I cried. If you're young enough, then smallpox has been eradicated where you don't need the vaccine. But guys in Iran and Iraq, when those guys were trying to use that biological warfare, they were trying to use smallpox as biological warfare. So a lot of the guys in the military didn't want to get the vaccine because it's a live vaccine. Tell me you're with me. All right, so watch. If you go to Walgreens and you get the flu shot, you got me? The little protein coat of that flu virus will have some receptors on it. And a specific B cell is going to match up. What does the B cell do then? It divides into plasma cells and memory cells, correct? And then on your first exposure, do you produce a lot of antibodies rapidly? No. But you can't get sick from the flu shot because it's an inactive virus. Don't ever say that. If you ever say that and I hear it, I don't care if I'm 95 in a nursing home. I'll drag myself out of bed, go to Gateway to their mainframe computer and change your grade. Right? You can't. So, watch. this process that I just explained to you, now you're going to have plasma cells and memory cells. You're going to have those memory cells, so if somebody goes, and hacks a loogie on you, now those memory cells are going to memorize it, and when they come in contact with the actual flu virus, they will divide into thousands of plasma cells and produce millions of antibodies rapidly to attack and destroy that flu virus before it infects you. That's how a vaccine works. Say yeah.
So the moms who are afraid to get their kids specifically the flu shot because they don't want their kid to get sick, it's all BS.
That's all BS. Now watch. Will the kid potentially get like a low-grade fever? Yeah, because watch. White blood cells come in contact with prostaglandins, but because it's not a virus that can affect your cells, that response is minimal. It's minimal. Tell me you got that. That's how that works.
I have people all the time that come into because I work at Walgreens. We're obviously promoting the flu shot, and so we have to ask them, "Do you want to get your flu shot?" And a lot of times the people say, "No, I've never gotten the flu shot, and I've never gotten the flu." Like, is that just literally because they've exposed themselves to it? So
Can I
much?
tell you? Watch. I don't get the flu shot. I touch people professionally all the time, right? So I'm exposed to people, like people's stuff all the time, and that's how you build your immune system, by being exposed to it.
I thought you have to for nursing.
No.
Unless you know the
Hospitals
right
don't.
people,
Right.
No?
And I'm an independent contractor.
because he doesn't have to.
I don't have to.
But
I'm not doing that.
But if you work at a hospital and you know the right person, they'll just sign it off for you.
Yeah. Yeah, I don't know. To me, our immune system has been around a lot longer than vaccines.
Think that I got one.
You know what I mean? You know what I'm saying? It's like, that's what I believe.
But like for here, you have to get it, and I found
Yeah.
out that when I did my EMT, I hadn't gotten one for like 12 years. Didn't know it.
Why do you gotta get a flu shot every year?
Because
Because
the
it
strain of the
changes.
flu comes out.
Right? Usually it's South America that they look at. And the strains of flu that are in South America move to the North America.
They usually get it wrong.
Yeah, most of the time. And this year it's quadrivalent, so there's 4 different flu virus strains in that flu shot. Usually it's trivalent, usually the top 3, but for whatever. All right, take a break.
So why'd they stop giving the flu miss?
No, you can still get it. The
Can you?
intranasal one,
Yeah,
but you can still get it.
I thought they stopped already.
It's quote unquote not as effective, but like they still give it to kids and everything.
Yeah, because it's an active form of flu.
Yeah, it is. You can actually get the flu from the nasal
But
spray.
a mom would rather her child possibly get sick than listen to it scream and cry because the needle's coming out.
Oh no, I've had both. My kids got the flu this past winter. It's horrible to look at your kids being that sick. And so
No.
this, I just had them get the flu shot, and so they screamed before the needle even came close to their bodies. And once they got it, they were like, "Oh, that didn't hurt at all." So it was nice of them to scream in my work loudly. Good time.
Nurses don't know how to give shots, man.
What?
No, ours was a pharmacist.
I'm great.
This is what you do when you give a shot, right? Like a little dart, and then as you're pushing it in, you don't push it in really fast because then it expands the tissue. That produces pain.
Right.
You slowly inject it. The needle's already in, right? Just slowly inject it to allow it to spread out so you don't get that big ball of fluid, and that's what produces the pain. Yeah.
I had a little. I was at Walmart and I got mine. Oh my god! I thought she gave me. That lady threw that thing in there.
The
She
pharmacist.
goes, "Take happy thoughts. It helps the antibodies go." And
Unique shit has some.
I'm like, damn, that lady's a ninja.
They had a pharmacist that got my kid a flu shot. Cause what if, right? So the pharmacist is gonna give him the shot like right here. I'm like, dude, I don't think you want to do it that high. I think you want to kind of just go like right here.
I know what I'm doing.
And I'm like, okay. And he goes, oh, okay, you know, and I hate that. You know, my sister, she's a nurse, right? She graduated from Gateway in like 1993 or 4, right? And every time, like, one of our family members in the hospital, and we're visiting, she'll like, well, I'm a nurse. I never say that, right?
You just know if they're saying something that's like
Right, if
not
it's
right.
goofy, right? I'm like, hey.
Wait a minute, I thought, and then they're like,
My mom,
how did you know that?
I don't care how old a woman is, they're still vain. They are, right? So my mom, she did not want to wear hearing aids because it made her look old. She was 86 years old. Right? I ain't going to argue with her, right? So anyways, my sister walks in one time. She doesn't hear, and she gets scared, and she falls, and she hits her head on the counter and puts a big gash right here. So my sister calls me, and I go, was she knocked out? No, she wasn't knocked out. I said, I'll come over and take a look at it. Anytime you have a scalp, right, laceration, it's a compression wound. It's going to split the skin. It's going to require stitches. That's just typically the way it works. So I said, Ma, you really got to go and get some stitches. Oh, can we just go into the walk-in clinic? I don't know. I don't think so, Ma. I said, you're on Plavix. They'll probably want to do a CT of your brain to make sure that there's no bleeding. So we go into St. Mary's, right?
Alert now.
What's that?
The trauma alert now. Any fall on a blood thin.
Right. So he goes, I don't think it'll need stitches. It's pretty approximated. We'll use that glue. And I'm like, okay.
Oh.
So he says, it was a physician's assistant. He said, did she lose consciousness? I said, not that I'm aware of. Well, I don't think we need a CT scan. I said, wait a minute. She's on Plavix. I think she needs a CT scan. Well, let me talk to the ER doc and see what he thinks. So he comes in and he goes, no, I don't think she needs it. I said, no, that's okay. I think she does. So he gets pissed at me, and then he orders it. And he comes back and he goes, it looks like she may have a small bleed. And he goes, she can stay here and we can have the neurosurgeon on call, or we can get you in the ambulance and have you transferred to Freighter. And I looked at him and I said, what do you think I'm going to do? Yep, he goes, okay, we'll get the ambulance for you.
And 3 hours later, LJ.
It was, but, so my mom's in the ICU, right, at Freighter, and then it's a teaching hospital. So I hear the doctor talking to the residents, right? And I'm like, that's right on. That's right on. That's right on. Right? I'm like, okay, Mom, you're in good hands. They're out talking. I'm like, I didn't say I was a nurse. I was dressed like a slob like I usually am. And I'm like, no, for real. And I'm like, yep, it was the right call. And then later he came back and he goes, I don't think it's a bleed. We don't think it's a bleed. We actually think it's a calcium deposit. She may have had a bleed years ago that just kind of, corrected itself, and she's got scar tissue there. I'm like, cool. So just real quick. So my mom, she had colon cancer, right? So she had the surgery at Freighter, right? So there was this young nurse guy who graduated from lacrosse, right? Real nice guy. And I said to him, I go, hey, my mom was just on pills in the hospital, or at home. How come she's gotta take insulin? And he goes, well, we like to clean their system out of all the medication, and then when they go home, they can start back on it. I go, oh. So there was a little whiteboard with your aide and your nurse, and I go, can I show you something? And he goes, sure. So I explained to him that when you have dis-ease, you get stressed, and that raises your blood. And he goes, that makes sense. I go, I know. And he goes, what do you do? I said, I teach nurses at Gateway. And then I go, my mom's got congestive heart failure. How come she's got to sit up? And he goes, well, if you lay down, all your abdominal organs will push on your diaphragm and make it more difficult to breathe. And he goes, you're going to show me something, aren't you? I go, yep. And I explained to him about venous blood coming back. He goes, that makes sense. I go, I know it does. Right? The education continues.
No, remember we were talking about DVTs and arteries?
Yeah.
Actually, I had an arterial block come in.
Yeah, but it wouldn't be a DVT.
No, it wasn't. It was an arterial block.
Right. That's an arterial thrombus. Was his leg, where was it, in the leg?
Yeah, it was in the popliteal.
Popliteal, right? So
Yeah.
was his toes pale and cold?
They, at first when we saw it, it was red, but it was hard as a rock. I thought it was cellulitis at first, but then eventually it got cold, started getting blue, cap refill started going away, just kept going.
There you have
The
it.
first thing I said was like, that lactic acid would be through the roof.
Yeah.
It was like 3 times what it should have been.
Oh, for real?
Oh yeah, it
Yeah.
was bad.
Yeah, he's in trouble. He was in trouble.
She's in surgery, I don't know what she has now.
Well, she better do good. Maybe she ambulated home. How many people followed that? Guys? Okay, here we go. Watch. I'm going to explain to you an allergy. You got me? How many people have hay fever? They're allergic to pollen. Okay, where does the pollen enter your body? Nose and eyes. Say yeah. Okay, so watch. In an allergy, this is one time the body does. Yep.
Sorry, I have a question before you start. I don't know if you'll explain it because you did in the video. Why sometimes do people have allergies and sometimes they don't? Because there was one season I had allergies really bad, and ever since then I've never really had it like that ever again.
I don't know.
Does it depend on literally what is in the air?
I think a lot of it does. And over time, if you're exposed to that same thing, you can get actually desensitized to it. And when I explain how an allergy works, then I'll show you that when you get allergy shots, it's actually what you're allergic to.
Right.
And I'll show you how that works and why it makes sense to do that. All right? So let's say, for example, that you're allergic to pollen. Okay? So you got pollen. That's pollen. If you've never been exposed to it, do you have a sensitized B cell? No. So when you are first exposed to it, that B cell is going to get, when it comes in contact with that pollen, it's going to get turned on, and it's going to divide into what?
Memory cells and plasma cells.
That's right, memory cells and plasma cells. So the memory cells are going to remember that, and remember on your first exposure, memory B cells, right? And plasma B cells, all right? On your first exposure to something, do you get a huge antibody response? No. So this is why it's important that when people develop allergies, right, you know, they like food allergies or something like that, they'll say, well, gee whiz, you know, I ate it before and it wasn't a problem. That's, that's because you don't have the memory cells, and the first time you're exposed to it, the antibody response is very, very small. So this is how it works. When plasma B cells form antibodies to this pollen, there's an additional step. And that additional step is that these antibodies that are formed, that's a terrible color. I need a good color for this. Yeah, this color. Yeah, that's really good. It looks like that color almost. That sucks. Those antibodies bind themselves to mast cells. And what do mast cells contain?
Histamines.
Where's the pollen? Where's the pollen?
In the air.
In your nose.
Nose, eyes. You got me? Now this is the important piece. On your first exposure to it, you may not even know you're allergic. But on your second exposure, you're going to get this massive release of antibodies. And what are they going to bind to?
Mast cells.
Mast cells. Where's the pollen? In your nose and your eyes. So when these antibodies circulate to the pollen, and the antibody binds to the pollen, the mast cell releases histamine. What does histamine do to arteries? Dilates them. So your nose gets stuffy. Your eyes get puffy. And what does it do to the capillaries? Makes them leaky. That's why your nose runs and your eyes water. Are you following? So watch. What do you give those people who have hay fever? You give them antihistamines. You better write this down. Antihistamines prevent the further release of histamine from the mast cells. Antihistamines prevent mast cells from releasing more histamines.
That's why you have to take it every single day. You can't miss a day or you restart the whole.
You got it. And watch. Do they do anything for the histamines that were already released? No. That's why. Watch. I wish I could spell. You take an antihistamine and a decongestant. What caused the congestion? Right. What actually caused the congestion? The arterial vasodilation, right? So, watch. I can't spell today. Can't spell any day. Pseudoephedrine. What does that sound like? It sounds like Sudafed, but what does ephedrine sound like? What does epinephrine do to blood vessels?
Constricts them. Dilate.
So the decongestant is pseudoephedrine, which mimics epinephrine, and that causes blood vessels to constrict. Where? Everywhere. That's why it says on the box, if you have high blood pressure, talk to your doctor before taking Sudafed. What are the side effects of Sudafed? Right?
Shakiness, tachycardia, high blood pressure. Anxiety.
That's why you don't take Claritin D at night.
I just took a Claritin D before bed the other night. And I woke up at 3 in the morning and was up until 5:30. I am not kidding you.
That's actually
And
why
I
I
was
take mine
sweating
together.
profusely. Wow. Okay.
So like at
Got
5
it.
o'clock in the morning when I need like some go-go juice,
But I felt great.
3 puffs of Symbicort, baby. I'm good to go.
Symbicort, that won't help. Symbicort's a steroid.
Oh, is it?
Yeah,
Oh, goddamn.
It's flowing.
That's like all in the head then.
I think it is. I kind of burst your bubble, man. Now you're going to wake up, you're like, oh, man.
Exactly.
Yeah.
Isn't it Flonase has epinephrine?
No, Flonase is a steroid inhaler too. Or a steroid like
Just the albuterol inhaler, right?
yeah. And then neosinephrine, you know, what do they call it?
My rescue.
What do they call that stuff?
What?
Vicks nasal spray?
Yeah.
That has neosinephrine in it. Neosinephrine is a vasoconstrictor and it mimics the sympathetic nervous system. That's why people get addicted to that stuff.
Or no, Afrin. Which one? It was one of them. That
Afrin or both have neosinephrine in
Wait,
it.
whoa. Vicks is great. It's good.
That's why watch. Did you ever see the original Rocky?
No, I'm talking about the one like you rub in your chest.
The original Rocky? Right before they fight,
Killed everything.
both of them get that nasal spray in their nose because it constricts the blood vessels so when you get popped, you don't bleed as much. That's why they do that. And it's more difficult to breathe through your mouth when you have a mouthpiece in, and you don't want to do that because dude hits you, and that acceleration of your jaw knocks you out. That's why you've got to keep your mouth closed. It's easier to get knocked out if your mouth is open. So if you're getting to get a fight, like, really clamp down.
You gotta say something real shocking first. And then, like,
Yeah. Tell me you followed that.
Symbicort is a steroid.
Yeah.
So why would Benadryl make you sleepy?
Benadryl, especially Benadryl. Benadryl has the ability to cross the blood-brain barrier, and it will affect the reticular activating system. It will make you sleepy.
I was like alcohol.
I'm telling you, man.
Isn't it because it thins out your blood as well?
What's that?
Doesn't it thin out your blood as well?
Benadryl?
Yes.
I don't know.
Because when I was suffering migraines really bad, they would tell you to take Benadryl because it helps like thin out the pressure in your head.
That or they're like, look, let's just give this chick to fall asleep. And she doesn't clean.
I think that was
That
it.
could be.
Yep, I think that was it. They were
They
saying,
just
give me a
both
line. I'll tell you, man. I took a couple Benadryl like a couple of months ago, and I'm sitting there, right? I'm watching TV, and all of a sudden it's like my body weighed like 9,000 pounds, and I'm like, I don't even know if I'm gonna be able to make it to bed. That stuff hit, and like my body instantly weighed like 100 pounds more. Like, oh, I did not like that. But man, you sleep good with that stuff. I'm like, damn, I slept like a rock. Right? And you know you sleep good when you wake up all flicted in a position, right? Then you got the crease mark from the sheet in there, you know? It's like, yeah, that was good. Tell me. All right, here we go. All right, we're doing real good. We're knocking this immune stuff out, huh? Feel good about it? Okay, here we go. What's this?
That's a boot.
Mm-hmm.
And there's a snake in it. I don't know that.
What's that?
That's a bee.
That's a bee.
Or an airplane with a thumbtack.
Yep.
Oh, that's scary. That thing is in there.
That thing went inside.
Yeah. Well, look, can you draw better?
Yeah.
Okay. Watch. If you're allergic to bees, when the bee stings you, where does the venom end up?
In blood.
In the blood. Where does the blood circulate?
Through the vein.
Everywhere. Tell me you got that. So, if the first time you get stung by a bee, you're going to get those B cells programmed, but the antibody response is very, very small. So you may not even know that you're allergic to bees. Say yes. But on your second exposure, you get stung by a bee, you now have those memory cells. So what happens to the amount of antibodies you produce? They go up, and all those antibodies that you now produced get bound to what? Mast cells. And what's a mast cell contain? Histamine. Where's the bee venom? In the blood. So when the antibodies bind to the bee venom in the blood, and because that bee venom's everywhere, it's going to cause a massive release of histamine. Where? Everywhere. And what does histamine do to arteries?
Dilate them.
And according to old Slola, if the arteries went like this and then they go like this, what happens to resistance to arterial blood flow?
Go down.
It goes way, way down. So what happens to systolic blood pressure?
They go down.
Way, way down. And if you don't have a mean arterial blood pressure of at least 60, you are in shock.
Your kidneys are being perfused.
That's right. What caused that massive drop in blood pressure?
The histamine.
The fact that you're allergic to bee venom. And what's the word to describe a total body allergic reaction?
Anaphylaxis.
So you are in anaphylactic shock. What's the treatment for anaphylactic shock? Epinephrine. Because what does epinephrine do to all of your blood vessels throughout your body? get it, and I say it every time, and I say it about 1 million times. I told you that the respiratory tract is very vascular. Didn't I tell you that? A million times. So when you get anaphylaxis, all of the blood vessels in your upper airway and your lower airway will begin to dilate. So people always say, it felt like my throat was closing off. That's because it is. And the lining of the bronchioles becomes inflamed, so the bronchial hole gets smaller, so they have a hard time breathing, wheezing. What suppresses the immune system? Cortisol. So after you give them epinephrine, you give them an antihistamine, because do you want further release of histamines? No, you don't. So you give them a Benadryl or antihistamine, and then you want to suppress the immune system. So they will be on prednisone in a step-down fashion. And now you know why. See how I related all that stuff? Oh, hey, relate. Tell me you followed that. So in order to get an anaphylactic reaction, that allergen has to be injected or ingested or inhaled. Tell me you got that. Tell me you followed that. Now, watch. What the hope is when someone's allergic to something, is that if you expose that person to a small amount of that allergen, that over time, when the B cells start producing antibodies, those antibodies that are formed will not attach to mast cells. That's desensitization. So that's how they do it. That's why if you've ever had allergy shots, anybody here have allergy shots?
I have a friend that does it.
So they usually go in early in the morning to the doctor, and then they have to sit there for 15 or 20 minutes to make sure that they don't have an anaphylactic reaction. That's why they have them wait.
Super expensive too.
Yeah, no. I just hack. I told you that when I got asthma, like when I was 26. I was coughing, night sweats. So I thought I had HIV. Did I tell you that? Well, this is back in the 80s, right? When, AIDS was like, HIV was everywhere. And I'm like, damn, night sweats, cough.
I got mine.
So I go to my doctor, I go, hey, check me for HIV. And he goes, what are your symptoms? I go, cough at night, night sweats. He goes, Tim, you got asthma. I go, oh, okay, that ain't bad. And I was happy to leave with my inhaler. Right. Yeah, but that was, it was weird. And here's the weird thing now. I haven't had any problems with my asthma at all. And I don't know why. It's just, I don't know if it was environmental, but I can't really explain it. But that's that. Say yeah, guys. Did you follow that? All right, hang on. All right. Hang on. Describe the functions of the lymphatic system. I did that. Describe the process of inflammation. Did that. Explain the function of lymph nodes. Describe the location of lymph nodes in the body. Explain how and why a fever develops, including your answer how acetaminophen and ibuprofen work. I did that. Explain how a vaccine is used to prevent disease. I did that. Define anaphylaxis, explain anaphylactic shock, and explain the correct treatment. I did that. Say yeah. All right. Do you guys know the blood types?
Yes.
Yeah.
AB, and O.
Okay.
Without the RH factor.
Can you tell me why AB positive is the universal recipient?
It doesn't have any antigens,
No,
antibodies.
no, because they don't have. Yeah, no, that's right, because they don't have antibodies to A or B.
Right, so they can.
But why is it AB positive?
Because an RH factor still produces an antibody. So if it's a negative, it's not the right blood type, so you still have an antibody to it.
So, hold on. If a person is AB positive, can they receive AB negative blood?
No.
Wait. Yes, they can.
Why?
Because wait, you can't go the other way around. You can go negative.
Why?
You can't go positive. Negative.
Why?
No one for me.
Hang on, wait.
I'm trying to
I still got that
get
notebook.
this information.
Just believe I have that section outlined too. Hold up. I know Nicole explained that at one point. I
That's
can't
what I was
remember.
just
Well, yeah,
thinking
that's what I
about.
was thinking about too.
If you guys would have,
Read the textbook?
no, if you would have,
Watch the video.
did you watch that
It's
video?
not in the video. I didn't watch those 3 videos. It's not in there.
It's not in there.
It's not in there?
No,
Hang
sir.
on. Getting close.
You trailed on at the end of the
Oh,
one
shit.
that's like an hour and a half.
Oh,
You had your class take a break, and then you never came back to describe that. See, I watched it. Just an FYI.
Well, that sucks.
Yeah.
On you like white on potatoes, man.
Trying to get my A.
Well, here's the thing. Watch, in my defense,
Endocrine,
okay?
reproduction.
It wasn't.
If those videos aren't good, then go to the other teachers that teach EMP and watch their videos.
I was just informing you that it wasn't there.
That's good to know, actually.
Yes.
All right. But there is a specific video on blood types, and RH factor.
I think. Okay.
There is. Okay? Let me just do that real quick, and then you can ambulate. Right?
Hang on. I'm almost there.
We did good. We did good today. All right?
Wrong way.
Here we go. These are the blood type. Write this down. Write this down. I'm not even playing. In order to get a transfusion reaction, you have to have a specific antigen and a specific antibody. If either one of those criteria are not met, you cannot have a transfusion reaction. Do you understand that? Specific antigen, specific antibody. All right?
Oh, that's why.
Now watch. Whole blood is the red blood cells and the plasma. When a patient receives blood, do they receive whole blood routinely? No, because we learned that plasma of the blood is 0.9% sodium chloride, right? So why give them the plasma of a person's blood, to donate when there's a lot of crap in the plasma that person may not know and have an immune response to, right? So this is very important. When they give a patient blood, it is almost invariably the red blood cells separated out from the plasma. So when people get blood in an hospital, that's Spanish for hospital, they get what's called packed red blood cells. The plasma of the blood is removed, and what's left are the red blood cells. Are you with me? You're following this? You got me? So, I'm going to say it again, because this, watch. When a patient is given blood, they're given only the red blood cells, not the plasma. Say yes. Guys, here's the other thing. In the plasma of the blood, when you are born, preformed, you have antibodies floating in that plasma. So if you have type A blood, you have A antigenic proteins on your surface, and you have type B antibodies in your plasma. Say yeah. Type B, you got B antigenic proteins, and you have type A antibodies floating in the plasma. Who's following? If you have type AB blood, it's like a freaking birthday party. Look, you got balloons and party hats there. It's a party. but they don't have any antibodies floating in their plasma. What did I tell you? In order to get a transfusion reaction, you have to have a specific antigen and a specific antibody. And if either one of those criteria are not met, you won't get a transfusion reaction. Say yes.
What do you mean by transfusion reaction?
Mean if you give the person the wrong blood, they will immediately have a transfusion reaction. And they will go into what's called DIC, disseminated intravascular coagulation. Blood will start clotting and clumping together, and you will use up all of your blood clotting factors. Even though you are clotting, then you'll start bleeding to death. That's how they die. That's why when a patient is given packed red blood cells, the nurse has to check their vital signs every 15 minutes. And if it's not an emergency situation where they just need some extra blood, that blood drips in very, very slowly, because they want to make sure that they don't have a transfusion reaction. And it's immediate. It's immediate. Have you ever seen somebody be given blood that's conscious? They'll start shaking. They'll get a little fever, because you can't purify these red blood cells completely. So there's some junk in there. How many people got that? Type O blood is the telesavalis of red blood cells. It's ball-headed, completely ball-headed. It ain't got no antigens on its surface. So if you ain't got no antigens, can you get a transfusion reaction? No. So in order to get a transfusion reaction, you have to have a specific antigen and a specific antibody. If either one of those criteria are not met, you can't get a transfusion reaction. That's why O negative blood is a universal donor. It's ball-headed. Say yes. You followed. But watch, people with O blood, they got both A and B antibodies floating in their plasma. So the only type of blood that a person with O blood can receive is O. Now you know. Now you know why. See? Okay, watch. Write this down. I'm not even kidding. If you write it on your digestion quiz, 20 points of extra credit. No joke. Ready? I want to do it on the respiratory and kidney. I'm going to see if you remember it. I'm driving in today. I'm thinking to myself, you guys would be like freaking Rhodes Scholars. You'd be like writing books. You'd be on tours, right? If you learned everything that you learn when it's extra credit. You should see extra credit. You're like, you're like a cat. Here we go. I'm just going to say it. You can write it down. Now I forgot what I was going to say. Oh, here we go. Your immune system can't react to nothing. Can your immune system react to nothing? Right. That's good. So watch. Watch. Why is O negative blood the universal donor? It has no antigens on its surface. So right then and there, one of the criteria is not met for transfusion reaction. Can your immune system react to nothing? The education is going to continue right now. This is A positive. Positive means they have the RH factor. The RH factor is dominant. 85% of the population has the RH factor. The only time it is an issue is if the mother is RH negative. I'll explain that later. So a person with RH positive blood, or A positive blood, what's floating in their plasma? B antibodies. Say yes. Guys? So can a person who is A positive can they receive A positive blood? Yeah, that's the blood you want to give them. Tell me you got that. Can they receive A negative blood? Can they receive A negative blood? Look at what you're going to get 20 points of extra credit for. Then rethink it.
Yes, because your immune system can't respond to that.
Right, and there's nothing for it to react to. So, if you ain't got it, the Rh factor, there's nothing for the immune system to react to. Do you follow that? So, that's why a person who is Rh positive can receive Rh positive or Rh negative blood. Because if they're Rh negative, there's nothing to react to. That's why you got 20 points of extra credit. Tell me that made sense. If you're A negative, can you receive A negative blood?
Yeah.
If you're A negative, can you receive A positive blood?
Yeah.
No.
Does a person with A negative blood know that Rh factor? Does their immune system know that Rh factor? No. So they will produce antibodies and you will have a delayed transfusion reaction, but you will have a delayed transfusion reaction. Tell me you got that. So a person who is Rh negative, because their immune system doesn't know the Rh factor, can only receive Rh negative blood. Yes or no? We're going to find out. I'm going to tell you right now, you give the person the wrong blood type, they put you in prison. Right? You become a friend of Bertha.
So wait, and that's why when they, in an emergent situation where they can't do a typing screen, they just automatically throw O neg.
Watch.
It's damn near impossible to get it wrong.
Watch. If a person has A negative blood, can they receive O negative blood? Why?
No antibodies react.
It's ball-headed. Nothing. Nothing for the immune system to react to. That's why O negative blood is a universal donor. Yes or no? Okay, I'm going to do this and you can ambulate. See, I was getting upset there. Yeah, I know I shouldn't yell. I was listening to some of those videos. I sound hostile. What type of blood is this? AB what?
Negative.
Right, now I'll make it positive. What's floating in the plasma of a person who is AB positive? What type of antibodies? Nothing. 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 And in order to get a transfusion reaction, you have to have a specific antigen and a specific antibody. Say yes. So can a person who is AB positive receive O negative blood?
Yeah.
Can they receive O positive blood?
Yeah.
Yeah. Can they receive A positive blood?
Yeah.
Y-
Yeah.
yes. Can they receive B positive blood?
Yeah.
Can they receive B negative blood?
Yeah.
No.
Yeah.
No.
Yes.
Yes.
Baby positive is universal.
Right, and now I'm going to explain to you why. Right? Watch. There's no preformed antibodies, and can your immune system react to nothing? Because they have the Rh factor, they can receive Rh positive or Rh negative blood. And because there's no preformed antibodies to a person who has type AB blood, they can receive any type of blood. Say yes. You got that. Do you know what type and cross match means?
Yeah.
What does it mean?
Find out what kind of blood type
What's the cross match?
The opposite.
Type it, you find out the person's blood type. You got me? Then what you do is you find a sample of that blood type in the blood bank,
See if it coagulates.
and then you take the patient's blood and the blood they're going to be given, and you mix it together to make sure that there's no nasty transfusion reaction. That's the cross match. And it takes time. That's why O negative blood is given rapidly in emergency situations. And if they don't have that, then they give them volume expanders like saline. And we learned that oxygen can be transported in the plasma of the blood. Say yeah. All right, ambulate home. Guys, when's the quiz is on Monday, yes?
Yep.
Okay, do you want to start early?
Sure.
10 o'clock? Yeah? Is that okay? All right, 10 o'clock.